The most dangerous mistake in CPR is not doing compressions badly. It is deciding the person does not need them. Because cardiac arrest does not always look like the movies. And the single most common reason a bystander stands there and waits is that the person appeared to still be breathing. So this is a lesson about recognition, not the numbers, the decision that comes before them. Here is the rule everything else rests on. Gasping is not breathing. It is a sign of cardiac arrest, and it means start CPR. Gasps are slow, irregular, noisy attempts at air. Gasping, snorting, or gurgling, often only a few times a minute. They can go on for several minutes after the heart stops, and they look like life. That is exactly why people wait. Normal breathing is regular, quiet, and you can see the chest rising and falling steadily. If you are unsure, treat it as a rest. The cost of starting compressions on someone who did not need them is far smaller than the cost of waiting on someone who did. So here is the actual recognition sequence. Check the scene is safe. Tap the person and shout. If they do not respond, that is unresponsive. Then, if you are a healthcare provider, check breathing and the carotid pulse at the same time and take no more than 10 seconds. Simultaneously, because checking one and then the other wastes time that costs survival. And if you are not a healthcare provider, you do not check a pulse at all. Unresponsive and not breathing normally is enough. Pulse checks are unreliable even for trained people, so the guidelines simply removed that step for lay rescuers. Let us work one. You reach an unresponsive adult who is making occasional slow gasping sounds but is not breathing normally. What do? Monitor them since they are still breathing. Place them in the recovery position. Begin CPR because agonal gasping is a sign of cardiac arrest, or give rescue breaths only. Begin CPR, those gasps are not breathing. The recovery position is for someone who is unresponsive but genuinely breathing normally, and here they are not. Monitoring is the exact mistake that costs lives, because agonal gasping fades, and by then minutes are gone. One more on the order of the first moves. You are alone, the scene is safe, and you have confirmed an adult is unresponsive by tapping and shouting. What comes next? Start compressions immediately. Activate the emergency response system and send for an ED check for a wallet card, or begin rescue breaths. Call for help and get an AED for a witnessed adult collapse. The most likely cause is a heart rhythm that only a defibrillator corrects. Compressions keep blood moving, but they do not restart that rhythm. So the shock has to be on its way while you do CPR, not after. Try one yourself. For a healthcare provider assessing an unresponsive adult, how should breathing and pulse be checked? One after the other, taking as long as needed. Simultaneously in no more than 10 seconds. Pulse first, then breathing in 30 seconds, or breathing only, pause and decide. Simultaneously in no more than 10 seconds. The 10-second limit exists because every second without compressions lowers the chance of survival, and a long, careful pulse check feels responsible while actively doing harm. So to recap, the dangerous error is deciding someone does not need CPR. Gasping is not breathing, it is a sign of arrest. Unresponsive plus not breathing normally is enough for a lay rescuer with no pulse check. Providers check breathing and carotid pulse together, 10 seconds maximum. And for a witnessed adult collapse, call and get the AED first. One last thing, this is study practice, not medical training, and it does not certify you. In a real emergency, call 911. Practice these with free CPR questions at .com/en/CPR.